Right. First of all, let's go to start and measure the patients to see what size you need. If this is the side who's affected, you got to use the opposite side to measure it. That way you don't give her any pain. You usually just got to get from the palm of the for the hand. You can use the web roll, which is this roll, and you got to stop like 2 inches from the elbow down here, and that's as you measure it. You can use a little piece of web roll like this, or you can actually use the test measure, which is the same way to do it. Palm of here, that way you know when you got to use it. If you don't have all this, you can actually use one of the hospital tape, which is this, and it's the same way. You use it like inches from the palm of and 2 down, and that's just the way you got to do it. After you have the measures you need, you want to make sure that you have the plaster, and this is the plaster. He come already made like this, and you can see the size. Her arm is bigger enough to use this is 5 by 30. That's what I've been using it for her. And after that, you have that set up. You have your little mark. You got to get a web roll. If you're using the 5 plaster, you have to use a 6-inch web roll. What you got to do is you got to do by layer. This is 1 layer, and you actually go a couple inches up, a couple inches down more, and you're going to do like a 6 of this. This is 1, 2. This is the 3rd one. This is the 3, the 4, I'm sorry. This is 5. You can do 5 or 6. In this case, I'm going to use 6. You break it. Usually what I like to do to prevent a lot of brokenness, I usually like to cut this little corner a little bit, to make it more beautiful, you can say. You can do it both sizes. After you got this done, you put it in the side, and you're going to measure your plaster to make sure it's the size that you need. And you get a pair of scissors. You can actually cut in it. Go in this way, make it kind of angle out. You are ready to apply this splint. You got to get your glove, and let me get the water. Got to have the water set up already. The water has to be room temperature. It cannot be hot. It cannot be cold. Usually what you got to do is you got to get the splint this way. You got to hold it like this, and you got to submit it inside the water. Straight down. Wait a couple seconds to let the bubbles go up. When you see there's no more bubbles, you're going to bring it up, and you're going to do like an X here, and you're going to get it through the corner, and you're going to squeeze it, trying to get all the water out. You're going to squeeze it until you see no more water coming up. After you untwist it, there we go. And you're going to get it up. The same way you put it out. We're trying to get all the wrinkles. The easy way to do is usually use the 2 fingers to get everything, all the wrinkles out. You need to have all the wrinkles out. Other splints you cannot have wrinkles, because wrinkles can make sores in the patients. After you got almost all your wrinkles up, you put it in the top of the table, and you're trying to set up all the wrinkles. Plaster usually take 5 to 10 minutes or more to do it. I mean, you have enough time to work with the plaster. Then you got your web roll, and you're going to put it in the top, kind of in the middle. You smooth it back again, and you fold the edges of the web roll, both sizes. Make sure you always, the side is going to touch the patient is the side who had the web roll, which is this side, is the side that always going to be touching the patient. And you're going to put it up this way. Palm crease always, make sure that he have enough room to close the hand. Don't worry about if that's go up. You're going to mold it a little bit. After that, you get elastic bandage, which is, this is a size 4. You start it in the wrist size. This way. Do not stretch this. Go normal. After you go here, you can go once in here, back here, go around. And after this down, you can actually go 1.5. And you know you're doing 1.5 for this gore line you have up here. You come back with this one, and you have 1.5 up here. Do not stretch it enough to cover it up. If the one is not enough, because the hand is big, you can actually use another one to cover everything out. But you see 2 fingers from here. When she bends, you have enough room to bend. The wrist, depending on the fractures, is there something, the wrist, this is the normal wrist one. So this is your splint, done, already set up. Plaster usually take a couple minutes to set up. I mean, you need to hold it. And at the same time you hold it, you can mold it in the same way the arm actually look. Plaster usually takes 24 hours to dry, completely dry. And for usually 5, 10, 15 minutes, you can let the patient go. You want to tell the patient to keep the hand the same way it is. And the way you mold this up, make sure you are not using your fingers. You're using your palm of your hand to mold it up all around, because if you use your fingers, you're going to put fingerprints, and you're going to have sores in the patient, and you don't want to do that at all. Okay, this is the splint using plasters.